Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 436. Cavernous Sinus. What is the cavernous sinus? Cavernous sinus is a collection of venous sinuses on either side of the pituitary. Describe the drainage through the cavernous sinus. Blood from the eye and the superficial cortex drains into the cavernous sinus and then eventually makes its way into the internal jugular vein. Name the nerves and vessels that pass through the cavernous sinus on its way to the orbit. The nerves and vessels that pass through the cavernous sinus on its way to the orbit includes cranial nerve 3, which is the oculomotor nerve, cranial nerve 4, which is the trochlear nerve, cranial nerve 5-1, which is the ophthalmic nerve, cranial nerve 5-2, which is the maxillary nerve, cranial nerve 6, which is the abducens nerve, postganglionic sympathetic fibers, as well as the cavernous portion of the internal carotid artery. All these pass through the cavernous sinus en route to the orbit. One thing to note is cranial nerve 5-1 and 5-2 are the only two things that pass through the cavernous sinus because they help in controlling the extraocular muscles. Cranial nerve 5-3 does not pass through here because it does not control extraocular muscles. Describe the picture here of the cavernous sinus. In the picture here, we'll first of all start where it says the optic chiasm, so that's the picture of the optic chiasm. Right below that you see the hypophysis, which is the pituitary gland, and on either sides of this you have the cavernous sinus, which is all that blue stuff that you see here. Here we see two internal carotid arteries, and one of them is the cavernous portion of the internal carotid artery, and one is not. So you can see both of that here. There is also the anterior clinoid process. You see the oculomotor nerve here, which is cranial nerve 3. You see trochlear nerve, which is cranial nerve 4, ophthalmic nerve, which is cranial nerve 5-1, maxillary nerve, which is cranial nerve 5-2, abducens nerve, which is cranial nerve 6, and it also shows the dura, the arachnoid, and the pia mater. What is cavernous sinus syndrome? Cavernous sinus syndrome is a condition that occurs due to mass effect, and that mass effect happens if there is any sort of tumor of the hypophysis. So if there is a pituitary adenoma, these tumors can get large in size, and due to that, it will create a mass effect due to the size of the tumor, and that can cause compression of nearby nerves, and that would lead to ophthalmoplegia and decrease in corneal and maxillary sensation with normal vision. Define ophthalmoplegia. Ophthalmoplegia is paralysis of the muscles within or surrounding the eye.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.